Jennifer Crouch. I'm our Director of Development here at VillageReach, and I'm happy to welcome you to this session. We want to welcome you to today's Tea and Learn, where we're here to talk about VillageReach's COVID-19 vaccine work. And today we're going to be sharing with you some details of our work in the Democratic Republic of Congo, where we've set up high-volume vaccination sites that are locally known as Vaccinodromes. And today I'm joined by two of my colleagues, as I mentioned to those of you who were on the line a couple minutes ago. Freddie Nkosi, who is our VillageReach Country Director for the DRC, is here in our offices in Seattle today, which is really wonderful. And Vidya Sampath is our Director on Data Analytics team, and she also has been leading our COVID-19 high-volume site work in DRC and in Cote d'Ivoire. So I'm going to give you a brief agenda and overview of VillageReach, and then we'll move on to talking about the real reason why we're all here today. So we're going to talk a little bit about VillageReach. I'm going to give you an overview of our response and the context as it relates to DRC, tell you a little bit about Vaccinodromes and what you should know about them, what our challenges have been, what are the pivots we've taken in terms of our strategy, lesson learned, and then we want to save a lot of time for you to ask questions. So we're going to save at least 15 minutes at the end for all of your questions about what Freddie and Vidya share today. So please feel free to put your questions in the chat at any time, and when we get to the end of the presentation, I will direct your questions to them. Okay, so for those of you who might be new to VillageReach, our mission is to transform healthcare delivery to reach everyone. In the last year alone, we have increased access to quality healthcare for 58 million people. We work across sub-Saharan Africa, and our three core country offices are in the Democratic Republic of Congo, which is what we'll talk about today, Malawi, and Mozambique, and we work with partners across other countries as well. We exceeded our target of reaching 50 million people by 2023 already this year, 2 years early, so that's really exciting for us to see what's ahead in the year ahead of us. Okay, so when we think about the way VillageReach approaches our solutions, we think about it in three different areas of focus. One is around pathways to primary healthcare. We think about the barriers that prevent someone from getting access to the products that they need in order to have a healthy and productive life. We think about Pathways to primary healthcare is thinking about access to information. This is primarily through digital solutions that VillageReach uses, such as Health Center by Phone, which those of you who may be calling in from Malawi may be familiar with as CCPF. When we think about products to people, we think about the products and how the barriers that affect people getting them in the places where they live, in their communities. That's what we'll talk about today, is one aspect of that with COVID vaccinations. And we think about how we drive sustained impact. So we think about how do we sustain our solutions beyond VillageReach's touch points so that they can be taken up by governments and by private partners to drive sustained impact at scale. So today we will be talking primarily about products to people, and so I'm very pleased to turn this over to my colleagues, Freddie and Vidya, who will tell us a lot more about how we've been working in DRC to respond to the current pandemic. Vidya.
Thanks, Jen, and hi, everyone. It's great to be here, and thank you for joining us. Next slide, please. Before we start talking about the Vaccinodromes work, I'd like to just take a moment and talk about March 2020, when the pandemic first started, because the principles that we used for our COVID-19 response is the same set of principles that also govern the way in which we have responded to the COVID-19 vaccines delivery in many parts of the world. Our 20 years of experience in transforming healthcare delivery at the last mile and working with governments has really positioned us well to aid in all types of COVID-19 response efforts. So the core principles governing the response in one, to government and sector, by really ensuring that the solutions reflect both government priorities as well as bolster rather than replace existing systems. We also want to make sure that we're building on what we know works from our years of experience and the solutions that are already in place. We believe strongly in collaboration and communication by being really clear about what we as an organization have to offer and how we can support others. Really what we do together is more effective than what we do on our own. And last, really responding to the present moment while thinking ahead for the future and designing for that future by building stronger systems for after this height of this pandemic period ends. So over here, what you see is a map of all of the different COVID-19 vaccination sites that we've been involved with and our larger COVID-19 vaccine delivery work as well. Since 2021, we have designed and operated 11 vaccination sites, including in Washington State, Côte d'Ivoire, and the Democratic Republic of Congo. Over 190,000 people have been vaccinated so far at a VillageReach supported site. We're also supporting COVID-19 vaccine delivery efforts like improving data systems and supply planning in countries like Liberia, Malawi, and Mozambique. We have vaccination sites called Vaccinodromes that are currently located in Abidjan and Kinshasa. The Abidjan Vaccinodrome has vaccinated over 14,000 people since it opened at the end of 2021. And the 4 Kinshasa Vaccinodromes, which we'll talk about today, have vaccinated over 56,000 people since also opening at the end of the year.
Yeah, before we discuss the work that went into opening the Vaccinodrome, we would like to give some context for the DRC. The Democratic Republic of Congo, for some of you who may know the country, is the 4th most populated country in Africa, with a population close to 90 million of people spread in a geographic size of 2.3 square kilometer, 2.3 million square kilometer, which is pretty much 3.5 times bigger than the state of Texas or 2/3 of the Western Europe. Kinshasa is the capital city of the Democratic Republic of Congo, is a home for 12 million of people. In terms of COVID vaccination coverage, at the moment, we stand at 2% of coverage. However, it is also important to mention some other vaccination campaign happening at the moment in the country, including Ebola vaccination campaign to combat the current Ebola outbreak in Equateur province. There is also yellow fever campaign, measles, and polio. Now, let's move to the strategic planning that went into opening the Vaccinodromes in Kinshasa.
Hija, you're on mute still.
Yeah. So when we first began designing these sites in Africa in partnership with the Gates Foundation back in August of 2021, there was a real sense of urgency to speed up the vaccination rates in Africa, as you can see from some of the news headlines snapshots on the slide here. This sort of urgency was further by the spread of the Omicron variant, which was identified in Botswana at the end of November. And this feeling that speed was critical here meant that there was broad consensus that governments couldn't rely on their existing health centers alone to perform COVID-19 vaccinations that would reach their entire adult population quickly. So with the opening of the Vaccinodromes, VillageReach is really trying to fill that knowledge gap in terms of what types of COVID-19 vaccine sites can meet the needs of the communities, as well as the high vaccination targets that are set by governments. Next slide. In terms of why Vaccinodromes needed, there are several constraints that we face in just getting large parts of their population vaccinated. And some of these reasons are that, one, they're not centrally located, where people are going for work or congregating in general during the day. They have limited duration. Often they end their services by 3 p.m. or so. The centers are quite small in their physical space, providing so there's a bit of competition in terms of also waiting for other health services to be given, so getting your COVID-19 vaccine. And parking space around these health centers because they're not catering to large swaths of your town or city up to get. So on the other side of it, we have what we call the Vaccinodrome model. And what the Vaccinodrome is, it's very vaccinate 100 people per day. And the all outreach go out into communities right around. So as you can see this slide, there in the middle is one of our vaccination sites, and you can see how busy and vibrant it is and how many people there are. So the drones that we have stand out for a few reasons. They're open 7 days a week, 12 hours a day. So they're really feasible for most people's schedules. We also run daily exit surveys at each of our sites, and those surveys indicate that clients find that there is high quality of experience, patients are welcoming, and it makes them trust that medical experience of getting vaccinated. And this then creates a positive ripple effect in the community, leading to more people seeking vaccination. There's immediate data upload so that the government can see on a daily basis how many people are vaccinated. This avoids historically no data backlog. And there's also individual follow-up that is done where staff site to call and remind people about their second doses and also check in with if they have had an uncomfortable side effect while they were still at the Vaccinodrome, or that we found out about an adverse event afterwards, which has still been really rare. That we opened was in Gombe, and this Vaccinodrome was opened in partnership with the DRC Ministry of Health's immunization program in late November 2021. And the opening of the site coincided with a mass immunization campaign that the government was conducting. So there was a lot of marketing and advertising of the site as well. It's located in a really busy plaza, which is surrounded by hotels and the central railway station and the bus station. And the site was large enough to vaccinate about 5 people a day. In order to get the site, it took 3 months planning and setup. This long lead time at first was because we needed to get the necessary approvals and licenses from the different levels of government. We had to procure the tents, and we also had to establish our credibility to administer vaccines. So the trainings and training community health workers. I'll show you some that really paints the story of how the vaccine delivery has happened so far at these Vaccinodromes. The first phase of Gombe had high demand, but then the pace started to falter, as you can see in the 3 months of data that's visible here. The early data supported our approach for having this large centralized site, because the site accounted for 18% of all vaccinations that took place in Kinshasa province in just its first month of operations. And this was the largest of any site in the province. No other site achieved this amount of people vaccinated, and in fact, 93% of the remaining sites together accounted for less than 1% of the vaccinations happened during this time period. Again, low vaccination rates at existing health centers points to that issue of face and access. So the Vaccinodromes were able to address this at a much larger scale. However, the pace of vaccination began to decline by February 2022, and so the team decided to take a look at that hyper-local data to see what changes could be made. Next slide. So the second phase witnessed an operational pivot that was both nimble, in that it was fast, as well as data-driven. The decline in the number of vaccinations I talked about between December and January may have been reason enough to completely abandon this model. But instead, we took a closer look at the hyperlocal data, and we shifted our approach. We looked at the daily exit surveys from the site, and this showed that 55% of visitors were referred by either a community health worker or someone in their personal network. So that word of mouth was a powerful demand generation tool in settings with high vaccine ambivalence. So in response, we scaled down the Gombe site and we opened 3 additional smaller sites in other Kinshasa locations where people congregated in large numbers each day. In addition, we also identified more than 100 community health workers and trained them to do community sensitization and trained them to also provide referrals in the neighborhoods around these 4 sites.
Just to add on what my colleague Vidya said about the location of the Vaccinodrome, look, I think location is one of the success factors of the Vaccinodromes in Kinshasa, and that should be also the case elsewhere. The EPI identify over 10 strategic places in Kinshasa where Vaccinodrome could be set up. And the 4 Vaccinodromes which are currently functioning are located in a very strategic places where people embark or disembark from public transport or transit from or to work. So those locations have been playing a critical role in terms of the success we're having in the old Vaccinodromes. When you look at the map you can see in front of you, you will see the site 1, Gombe, is located in the central business district where the majority of people go for work and they don't have to do extra effort to reach the site because they can stop by early in the morning going to work, or they can come back during lunchtime or after work when they are returning home. The second site, Kalamu, is right in the center of Kinshasa, very busy place, a touristic place where the majority of people transit to reach different places in Kinshasa. The 2 other sites, Masina and Jili, are located in the eastern part of Kinshasa, most populated part of Kinshasa, where previously people were very hesitant for vaccination, but we are happy that now we can see the majority of the people vaccinated in the 4 Vaccinodromes are coming from actually the 2 last sites that we set up. And community health workers have been playing a critical role as far as COVID vaccination is concerned. Because when you look at the graphics in front of you, you could see the difference from February to March. In March, it is a turning point when the 4 Vaccinodromes were up and running. You could see by increasing the number of community health workers in March to support the 4 Vaccinodromes, that contributed to over a 300% of vaccination increase just from February to March. And this also continued to increase even in April. And community health workers not only sensitizing people around a COVID vaccination, but they are also contributing to combat rumors, myths, and misconception that people having around COVID and around COVID vaccination. So they have been playing a critical role to pass the right message in the communities where people they live. And their contribution across the 4 sites in the past months has been like 50% of people referred to the Vaccinodromes have been actually sensitized by the community health workers. So in comparison with the people who have been reached through the media, radio or television, accounted only for 9%. So this is a critical or a great contribution we are seeing the community health workers are bringing for the success of the Vaccinodromes. So the current phase where we are at the moment is focusing on sustaining the present momentum. Generally, the demand for COVID vaccination in DRC is very low compared to what we expected, but we start seeing a slight increase on demand, and we are trying to maintain that momentum by responding to that demand and by improving the quality of services people can access in the Vaccinodromes. You could see in the graphics, the numbers has been increasing since we increased the number of community health workers. We opened 3 additional Vaccinodromes in March. You could see the number has been increasing from March to April, and from April to May. Just to give you an idea, for example, just in the month of May, we have witnessed over 102% increase in vaccination rates. So this was a great success, and we hope this increase will continue even as we're starting the month of June. So I will let my colleague Vidya to share some of the lessons learned during the implementation of the Vaccinodromes, but also for future healthcare delivery in Kinshasa and elsewhere.
So as we discuss some of these lessons learned from operating the sites and how we're looking into the future, you'll notice a theme or a trend which isn't new necessarily, but it bears repeating, because as we do more of this work, the fundamentals still end up sort of being the same in terms of what we should continue to do more of as we look into the future. And they also tie in really well with the core principles that govern our COVID-19 pandemic response as well. So the first piece is on buy-in. Making sure that you have buy-in from stakeholders is fundamental. There has to be this buy-in at different levels of the health system as well as the community. Next slide. A second critical aspect is the budget. So really ensuring that you develop a comprehensive budget as well as a costing tool that allows you to monitor the changing costs as you continue to tweak your approach is critical to the operation of a successful site as well as any future sites that you might be considering. Next slide. As Freddie noted, location, location, location. Location must be convenient and central, and you look at how the target client that you have for your site, you look at what their needs are and what their preferences are in terms of location and the ease of accessibility, the time of day, and the safety aspects that we've talked about. Next slide. As you get your site up and running and as you continue to tweak your approach, really spend some time determining the number of personnel you need to manage the volume of visitors so that you're avoiding staff burnout. As we mentioned earlier, we do rotate off days at the sites and staff do work on 2-week schedules so that we are paying attention to their motivation levels and their sense of performance at the sites as well. Freddie, over to you.
Maybe I can add among other lessons learned. There is also the visitor's experience. the exit survey we conducted revealed the majority of people who visited the Vaccinodromes were satisfied the way the flow is designed and very convenient for them. There is one exit and one entrance. And also, some visitors, because they were satisfied, they reach out to their communities, to their family members, to relatives, and refer them to the Vaccinodromes. So I think the Vaccinodromes offer unparalleled visitors experience that you could not find elsewhere. And the last lesson learned is also to continue to use all sorts of strategies to generate a demand. You could see from the pictures the US ambassador and the famous musician Enos B, who visited one of our Vaccinodromes in Kinshasa, in Victoire. And they attracted a lot of people during their visit. And from the day they visited Victoire up to now, we have seen increased in the number of people coming for vaccination in that particular vaccinodrome. So we have been using different strategies, using even local ambassadors, including the photographers, the hairdressers, the taxi drivers. We have been using them to be the ambassadors within the communities. So moving forward, we are looking at ways to continue to bring vaccine closer to the communities and also generate demand for vaccination by intensifying mobile and outreach strategy, where in each vaccinodrome we have a mobile site to reach people where they live, do the door-to-door sensitization. We will continue to support the Ministry of Health and the EPI to set up new sites and respond to their request to have more vaccinodromes in Kinshasa, but also in the provinces in order to increase the throughput. And of course, we'll continue to leverage community health workers' effort as they have been instrumental in inviting people to get vaccinated in all the vaccinodromes. And we will remain open and flexible to continue to learn about client experience and exit surveys to make improvements where they are needed. So those are some of the lessons learned we would like to share with you. And I've seen on the attendance list, there are also the French-speaking participants. Feel free to ask your question, even in French, if possible. We will be able to address your question. Over to you.
Thank you. Thank you, Freddie and Vidya. That was great. Yeah, as I mentioned, if you have questions, please feel free to put them in the chat. If you want to pose your question in French, as Freddie said, we're happy to answer that as well. I'm going to start you two off with a couple of questions, though, that I have for you, and hopefully some others will follow suit. So, as you two know from the questions I've asked you in the past, I'm really intrigued about how we use community health workers to be successful in this effort. So I'm wondering, what can you tell me a little bit more about, maybe Vidya, can you tell me a little bit more about the trajectory of how we identified community health workers as a necessary component or a valuable component of these vaccination campaigns? How did we realize that that was going to be valuable? How have we tracked, when you say that 50% of clients are referred by community health workers or others, how are we tracking that information? Can you tell us a little bit more about that?
Yeah, thanks, Jen. I'm fascinated by this sub-story of just how powerful the impact of the community health workers has been in this effort. So I'm going to take you back to December 2021, when we were, 2 days into the Gombe site being open. We had funding, and our scope was to be site operators. We designed the site and we implemented the site, and that was our circle of control. Other organizations and other parts of the government were tasked with the responsibility of generating demand. And we noticed that in some of those instances, there were some issues with really having effective demand generation, really reach the people. And so we wanted to recognize that even though it wasn't our first responsibility, we asked ourselves, what can we do within our circle of control as site operators? What can we do to raise demand? And so with other VillageReach experience in demand generation and in thinking about that people-centered approach to healthcare delivery, we knew that community healthcare workers had that direct connection with their communities. And so we felt that it was part of our circle of responsibility to work with existing community health workers who we knew from previous work in this particular province. So we trained up a small number of them, just about 30 of them, and they were the ones that went out and did community sensitization in December. And in December, when we looked at the data, we saw that close to 45% of the vaccinations had been because people were referred to the site by community health workers. And so your question about how do we know that? How do we know it's a community health worker who referred these people? I actually think it's an undercount. So what happens is that when a community health worker talks to a person about the importance of getting vaccinated and says, hey, there is this site, it's located really close to you, these are the hours of operation, I'm going to give you a token, which is a piece of paper. It has my name on it and it has a date. Does this date work for you? Great. Take this to the site on that day and give it to them. You will be first in line to get vaccinated and we will take care of you there. And so these tokens are pieces of paper. And so about 45% of people in that first month brought that piece of paper. But I expect that the number is actually a lot higher because if you give me a piece of paper, I'm going to lose it. But I will go and visit the site that you talked to me about because you built my confidence in the vaccine and in the power of keeping myself healthy.
Great, thank you. Freddie, I have a follow-up question that I think is related to that. So so you mentioned when you were speaking about the experience, I'm so glad to see that happens to somebody else besides me when you take off your mask and your glasses at the same time. Happens to me too. You were talking about the experience of users at the facilities and how that is, particularly special, remarkable. You and your team helped put together a really wonderful video that we can send out to the people who are on this call about one person, Michelle's experience, visiting one of the Vaccinodromes. Can you give us a little bit more information about what is different and what has VillageReach done in order to ensure that this is a really positive experience for people who visit the Vaccinodromes?
Thanks, Jen. Maybe to add one element to your previous question regarding community health workers, because of their tremendous contribution in COVID vaccination and vaccination in general, we honored them on May 17 with certificate as a token of appreciation of the work they are doing. And some of them, they have been community health workers for 30 years or more. They've never been recognized in such a way. So coming back to your question about offering a parallel experience, we learn some people through the survey which were conducted in DRC. Many people, they're willing to get vaccinated, but the number was still low because of the accessibility, whether the vaccination site was far from the place where they live or far from the public transport, reason why we set up the Vaccinodrome in the strategic places. But also, we wanted to offer a friendly services where people can come and feel comfortable, welcome, and they can sit while they are waiting to be vaccinated. In Gombe site, for example, there is even a television where people can watch the news or soccer while they are waiting to be seen by a medical doctor or to be vaccinated. We offered water after being vaccinated because, it's very hot in Kinshasa and someone who just work in the vaccinodrome is sweating and the seat is very hot, might need just a glass of water. So we can at least afford to offer water to the people coming to the vaccinodrome, but also the people working in the vaccinodromes, the clinicians, the health workers, they are just friendly. They have been trained before the opening of the vaccinodrome. They have been trained. They are all friendly and they are motivated. So the flow, also the way it is organized, it makes it very easy for people to say like, well, I have only 20 minutes to stop. I can get vaccinated and spend 15 minutes in observation and go to work or go home. So they spend less time in the vaccinodrome. And that's something very motivating because no one in Kinshasa or elsewhere would like to spend more hours in the hospital. So the quality of service we are providing, it's totally different elsewhere. And every person who comes at the vaccinodrome feels like, wow, I was welcome, I like the service, and I can refer the service to someone else. So that's where we have been paying much attention to make sure that nothing is left out.
It sounds like it's paying off. And in terms of, when you were speaking about what's ahead, you talked a little bit about expanding to other regions, either in Kinshasa or in the provinces. What does that model look like in terms of scale up? In what ways are we going to be leveraging the existing model? In what ways will the Ministry of Health be taking on adoption of this model going forward?
Yeah, the moment we set up the first vaccinodrome, I always remember the meeting we had with the minister. He repeated 3 times the vaccinodrome at Gombe vaccinodromes. More than 1,200 people were vaccinated within a week. So that's phenomenal compared to the average vaccination site in Kinshasa. So the minister was so impressed. He recommended, why don't you scale up? Why don't you open more vaccinodromes in Kinshasa and more vaccinodromes in other provinces? So we will continue to support that request from the ministry, but also from the EPI by working with all other technical partners and donors to leverage the existing resources to scale up the model, which has been proven is working and very efficient in terms of increasing the number, but also offering high quality of services. We will continue to support the ministry in partnership with all other partners and donors to scale up the model in other provinces and also in other places in Kinshasa. For example, in Kinshasa, in 2 vaccinodromes, we are using the tent from WHO. That's a very good partnership we have with WHO, and that saves us a lot of money that we could pay by renting a tent on monthly basis. So we hope all other partners can bring resources that we can leverage and set up other vaccinodromes in Kinshasa and elsewhere.
What I really like about that is what you're highlighting is very aligned with VillageReach's approach. Those of you on the call who know us well know that our model is to learn and develop and scale things up, but we replicate often through partners. So proving out a solution and being able to use that as a leverage point. We're not a large organization, so we rely a lot upon that collaborative partnership that you're describing. So I think that's a really wonderful example of the approach working even during an emergency situation. Vidya, I wonder, since you led this process across 2 different countries, or supported this process across 2 different countries, are there any surprises that you found in DRC that differ from the work that we did in Côte d'Ivoire, or have you found it to be relatively similar?
I would say yes and no. I think in general, at the beginning, I thought that it would be a lot harder to have people show willingness to get vaccinated in the DRC. And my assumptions were immediately shown to be incorrect because, as Freddie said, it wasn't so much about not wanting to get vaccinated as it was about making sure that the vaccines came to the people. And so choosing those locations and choosing the experience that made people want to get vaccinated. And that has been the case in DRC. It has also been the case in Côte d'Ivoire. I think what's important to think about when you consider what type of vaccine site you want to set up as a government or as an implementing partner, there are several ways in which you can roll out COVID-19 vaccines. You can use your existing health centers and hospitals, you can set up these vaccinodromes, or you can do mobile outreach. And I think what this work has taught me is that you need a mix of all of these approaches in order to be able to vaccinate a large part of your population quickly. And there is a moment in time when one approach is better than all the others. And so keep listening to your data and keep a pulse on your community's feelings about vaccination, and then be ready to pivot and use the modality that most makes sense. So don't get too set in your ways, or don't get too attached to your one implementation plan.
That's a great statement. As we wrap up, Freddie, are there any final last words that you would have for any of our guests today?
Yeah, maybe to say it in French for the French participants. Donc, le modèle de vaccinodrome à Kinshasa a montré que c'est possible de répondre aux différents besoins de la population parce que les enquêtes, différentes enquêtes ont révélé que les gens, 80% des personnes voulaient se faire vacciner, mais très peu de gens se faisaient vacciner parce que il s'agit des questions d'accessibilité, mais aussi rapprocher la vaccination proche de la population là où ils habitent. Donc, c'est ça le modèle des vaccinodromes. Et nous pensons que le gouvernement, les autres partenaires, les bailleurs des fonds vont faire la réplication de ces modèles à Kinshasa et dans d'autres provinces. Merci.
Thank you, Freddie. And thank you for everyone for joining us. We're going to send out both a copy of this in case you want to send it to others in your organization or others in your family or whoever is interested in this. I'll also send contact information for everyone who participated in case you would like to reach out to us with any questions that you might have as well. We really appreciate everyone's time, especially for those of you who are joining where it is evening. Thank you so much for spending part of your evening with us, and we really appreciate your support for VillageReach, both as donors and as partners, and we look forward to connecting with you in the future. So on behalf of all of us at VillageReach, thanks for being with us today.